Hello everyone, today we are going to be talking on discordant couples. That is, when a couple, one person is infected with HIV and the other person doesn't have the virus. They are called discordant couples. Hello, this is Care Counselling Outreach, and of course I still remain your online counselor. My name is Rachel. If you are new here, where have you been? Please don't forget to subscribe to our YouTube channel and of course follow us on all our social media platforms. We are always available for you, and please, we are available for bookings. Don't forget to make any bookings for any counseling section of your choice. Couples, when one of the couple has HIV and the other person doesn't have the virus, they are being referred to as discordant couples. But today I am going to be starting from complex to simple. Pardon me, I'm supposed to start from simplicity to complexity, but today I want to start from complex to simple. So any discordant couples who are intending to have children, or would be discordant couples, who are intending to have children, here are the options that are available for you. Number one, after coming in contact with each other, you need post-exposure prophylaxis. That's a drug taken by the person who doesn't have the HIV virus after coming in contact with the other person who has the virus, after exposure, of course, within 24 to 72 hours. That drug is very essential. So the more you delay after exposure, the more it might not be able to suppress the virus. So it is advised you take those drugs. Meanwhile, it is an uncertain route or uncertain pathway to have children, because it doesn't ascertain that your fetus inside of you would not be contacted, would not have the virus, though it's a very slim chance. And on the other hand, it's a very rare or slim chance once the male party is infected, because he's not the carrier of the fetus. It's the woman that is the carrier of the fetus. So the chances become a bit higher once it is the woman that is infected with the HIV virus, but very slim once it is the man, because the man will make do of the man's sperm, and while the woman, she is the carrier, will make use of her egg. So the chances are usually high for the fetus to have that virus once it's the woman. But once it's the man, the chances are a bit lower. I want you to take note that anybody who has organ issues, who have been diagnosed with organ issues, cannot make use of this post-exposure prophylaxis. Meaning, if one of your organ has been diagnosed that it's not functioning effectively, you cannot take this drug. Especially those that have been diagnosed with kidney and liver problem, because our kidney and liver helps in reducing all the overdose of drugs in our body system. They help to reduce it, they help to filter those drugs. So if you are having this issue of liver and kidney problem, it poses more harm to your body system. It's more toxic to your body. It can lead to an unseen illness. So it's advised, once you have been diagnosed of liver or kidney issues, please do not make use of this post-exposure prophylaxis drug. Number one of this post-exposure prophylaxis drug is nephrotoxic. I don't know if I'm pronouncing it well. Please, my health workers should help me. Nephrotoxic, it is toxic to the kidney, but it helps to reduce the virus. Once the party who is negative makes use of this drug, it helps to reduce the rate at which the person can be infected. And number two of this post-exposure prophylaxis is hepatotoxic. That is toxic to the liver. So once you have been diagnosed with liver issues, please do not make use of hepatotoxic drug to help you, because it reduces virus, but once you have liver problem, it poses more harm than good to your body system. And take note of this, it is not uncertain that your fetus might not be affected with the virus, because once the woman is the one that has the virus, it's post higher risk of the child being infected. But once it's the man, the chances are slimmer than that of the woman, because the man will make use of the man's sperm while we make use of the woman's egg. She is the carrier of the child, of course. So in such cases, once the mother has an accident or she has a fall while carrying that fetus, it is advised for them to rush her quickly to the hospital so that see our obstetrician who will evaluate if the child needs to be carried out immediately, because once there is blood contact between the mother and the fetus, the child have higher chances of being infected with the virus. So once you have such cases, please do not relax. Just quickly rush her to the hospital to our obstetrician for fast or quick evaluation. So make sure you are always visiting your obstetrician and you are always visiting your counselor. And this is where trust issues come in, because it's not easy for a party who has the virus and the other party who doesn't have the virus to allow the person who has the virus to have sexual intercourse with he or she. So trust, let me not put issues. Trust is very essential in this angle for discordant couple of the virus. It's a very, very slim chance for the fetus to be infected with the virus. But once it's the woman, the chances is a bit higher from that of the man for the fetus to be infected. So that's why we always advise that once you have a fall as the woman, or you have as the woman who is the carrier, once you have little accident while your fetus is inside of you, you should quickly go to the hospital. You should quickly be rushed to the hospital. So our number 2 option, which we are going to be giving to these discordant couples, is low viral load. Low viral load is when the virus is being suppressed in the person's immune system. That's the infected person. When the virus is being suppressed due to the use of his antiretroviral drugs, meaning he or she has been making use of her or his retroviral drug as he ought to use it. He has been using it to the letter. He has been adhering strictly to all the rules and regulations given to him by his health personnel, and has been following his or her counseling section as he or she ought to be doing. That is where the immune system is able to suppress the virus, meaning the virus has been suppressed in the body. That is why it is called low viral load, because the immune system has been able to suppress the virus, making it difficult for him to be able to infect the other person who doesn't have the virus. But trust is highly needed in this discordant couple's life, because it's very difficult for you that has the virus to tell your partner, my immune system has been able to suppress it because of my partner. My immune system has been able to suppress the virus because of my antiretroviral drugs. I've been diligent with it, so my immune system has been able to suppress it. So this is advice for these discordant couples to always visit their medical doctors together, or their health workers together, able to know the essential needs that guide them, and they'll be able to understand that, okay, the immune system has actually been suppressing the virus due to the antiretroviral drugs, and it's advised that both parties should visit the counselor for counseling section. And the next number is IVF. Yes, IVF. We all know about IVF, but it's very expensive. That's the disadvantage of it. It's highly expensive, but it's another option that is advised for the discordant couple. IVF, that's bringing of the man's sperm and bringing of the woman's egg to become an embryo, of course, to a fetus. I want you to bear in mind that we cannot categorically say that this method of IVF cannot affect the growing fetus. Meanwhile, if the man is the one infected, it poses a very slim chances of the fetus being affected with the virus. But if it's the woman, the chances are a bit higher than that of the male. But the fetus is at very slim chances of being infected with the virus. So IVF is encouraged. The only disadvantage with IVF is that it is very expensive. That doesn't mean the infected party should not continue making use of his antiretroviral drugs. He should please continue with his medication. And the last but not the least option is adoption. Here, both the sperm and the egg of the male and the female is not needed. All they need to do is follow legal procedures to adopt a child. That is all that is needed in this last angle. So it is advised that as a discordant couple, you should please always visit your health practitioners and visit your counselor so that you can know the best method to adopt in reproduction. if you want to use adoption, if you want to make use of IVF, low viral load, and of course post-exposure prophylaxis. So you will know which one you should go for as a discordant couple. And I still remain your online counselor. My name is Rachel. Don't forget to book us for any counseling section of your choice. We are always here to help you. Bye bye.